Hello, thank you for visiting our poster booth today. This study explored the prevalence of physical activity, sitting time, and alcohol use in rural cancer survivors and looked at associations between physical activity and sitting time and alcohol use. Cancer survivors who are at least 18 years old and residing in central Pennsylvania were recruited to participate in the Partnering to Prevent and Control Cancer study. Cancer survivors were mailed an initial brief questionnaire and opted into the study by returning the questionnaire. Those who completed the brief questionnaire were mailed a more in-depth questionnaire assessing physical activity, sitting time, and alcohol use. 219 cancer survivors returned their in-depth questionnaire. Participants were in their mid-60s, mostly women, and had completed some college or obtained a college degree. Nearly 50% of cancer survivors self-reported high physical activity, exceeding the physical activity guidelines for adults and cancer survivors. Roughly 50% self-reported sitting for less than 6 hours per day on average and did not consume any alcohol. There was a clear association between physical activity and alcohol use. So similar to what we see in those with no history of cancer, rural cancer survivors who met physical activity recommendations or reported moderate to high physical activity were 4 to 5 times more likely to report consuming 1 or more drinks per week than those who did not meet physical activity recommendations. Although there was a similar trend for sitting time and alcohol use, the association was not statistically significant. The results from this study point to the need for including an alcohol component in our physical activity interventions to reduce cancer risk and recurrence, to avoid undermining risk reduction efforts. Additional research is needed to further characterize rural cancer survivors who are both physically active and consume alcohol, and to identify social and environmental factors that are associated with these behaviors. Thank you.